campaign. Arguing for the end of adult marijuana prohibition is easy because we have facts, science, reason, compassion, evidence, truth, and logic on our side. It is even easier when researchers catalog it all for us. Learn how to gather the facts on marijuana use, arrests, seizures, rehabs, drug tests, and more in this edition of Drug War Data Mining. Welcome back, everyone. 23 after the hour. In the last couple of episodes of Drug War Data Mining, we've shown you information from the TEDS-A database at the Substance Abuse Mental Health Services Archive. That's the treatment episode data set admissions, and it represents the public admits to rehab hospitals for what drug, what reason, and other data. And we've been using that to get you all the information you need on how many people go to rehab for marijuana. Well, that information came in really handy because of some of the statements that were made by Dr. Ronald Schwerzler, a rehab doctor who was arguing for the No on 91 campaign. Now, understand this audience was about 60-40. I'd say it's about 60% marijuana supporters, 40% that were opposed, and had been very calm and restrained, and I think maybe only had one applause break the whole time up till this point in the debate, which is about a half hour into the debate. Dr. Ronald Schwerzler talking about marijuana edibles in Colorado and why we've got to keep marijuana illegal here in Oregon. Serenity Lane's Dr. Ronald Schwerzler for the No on Measure 91 campaign tells how marijuana kills infants.
I would like to concentrate on those edibles. There have been 5 infant children deaths in Colorado that have picked up these drugs from gummy bears, fruity pebbles, but 5 young infants have died. Now, if that's not catastrophic, I don't know what is. If you lose an infant child. Huh? Yeah, it is.
3 out of 5 adults in Oregon rehabs who were flagged for marijuana were referred by the criminal justice system. Only 1 in 5 chooses to go to rehab. There are more adults coerced into rehab by drug courts and the criminal justice system for marijuana than all cocaine and heroin users in rehab combined. Adults forced into rehab by the criminal justice system are more than 1 out of 5 of all adults in rehab. Yet they say we don't have enough drug treatment space for hard drug users who really need it. Measure 91 dedicates 25% of marijuana tax revenues to drug treatment, prevention, and mental health programs. It also opens up thousands of treatment beds by removing adult marijuana users whose only problem with marijuana was getting caught. Vote yes on Measure 91. This advertisement produced by The Russ Belville Show and is not sponsored or endorsed by the Yes on 91 campaign. That made me so proud to be an Oregonian that kind of reefer madness was immediately shouted down by the audience. And a little later in the debate, Josh Markey tries to cover and say, well, nobody's died from marijuana, but the damage had been done. So much so that Dr. Ronald Schwerzler today had to issue an apology, and it's on OregonLive.com/marijuana if you want to check it out yourself. But had to issue an apology and admit that nobody had died from marijuana in Colorado. And trying to find that story, let me see if I can find the link to it. Jeff Mapes just wrote it up before I got on the air today. Here it is. Oregon marijuana legalization opponent admits he was wrong about children deaths. And his official statement at the bottom here: after our conversation today, I realized that my statement about children's deaths in Colorado is in error. There have been admits to ICUs for children who have eaten edibles and were hospitalized. I was in error and deeply regret any consequence of my actions. As a physician, I make every effort to be honest with my patients and myself. When wrong, I try to promptly admit it and make amends wherever possible. You got to add that little, 12-step language there, making amends. Doctor, if you're going to get out and represent yourself as a physician, represent yourself as an expert on the subject, maybe you ought to study up a little bit on it before you get on our local television and try to scare the hell out of people with flat out lies. Now, maybe lie is too harsh. Maybe he really believed it. lie would say that he intentionally was lying about this. Maybe it was just a misstatement. Maybe it was ignorance. That's still no excuse. Dr. Schwerzler, you need to recuse yourself from talking about Measure 91 from this point forward, because your credibility is shot in this state. And you're not going to get this to disappear down the memory hole anytime soon. This video is online at youtube.com/radicalruss, and I encourage everyone to paste it on your Facebook and pass it around to show how mendacious the prohibitionists get when